if you are not notifying people about the disease, how do they get to know it? We could see a bit of increased notification from Lagos and Ibadan, as in a way, where people just see the rash and then go to the hospital, and then they are checked and then sent to Niger Center for Disease Control, where those things are confirmed. But tell you what, there's no boundary in Nigeria. You don't need visa to go to anywhere. If you see a tick-up in Lagos or Ibadan, know that the adjoining states are also having their case. Nigeria is like an iceberg phenomenon, where you see a tip of the disease as the thing is actually spreading in the community. Lassa fever, monkeypox, they are endemic throughout the year in Nigeria. They're endemic. Sometimes it shifts to Edo State, sometimes it shifts to South, sometimes it comes to Abia, sometimes it gets to Lagos and the North. That's what we should realize, that endemic in Nigeria. We need to, craft response appropriately to deal with those things.
Okay, doctor, let's still talk about the symptoms. You said there's a 2 to 4 weeks window from the first symptom to the outbreak of the rashes on the body and what have you. But we also know from medical researchers and doctors like you that certain symptoms do not come out. They're not obvious, rather they're inwards. So for someone who just has the headache or the fever and the rashes do not come out, how do you address that, really? Because there are those who just dispel it as, maybe just stress, maybe malaria, especially in a nation like Nigeria, where we barely or rarely embark on regular medical checkups without being sick.
Okay, we'll link back up with Dr. Tuyi. Okay. But that is a very vital way to look at it, especially when you go to the hospital. Many times they don't even do tests. That is even from the doctors. They don't do tests. They just, well, I've seen this is malaria.
Okay. Hello?
Yes, go ahead, please.
Yes.
Did you get a question,
if you don't have a rash, I did.
Okay.
If you don't have a rash, then you are not talking. It's not monkeypox yet.
Okay.
Hello.
So the
if you
rash
have
has
fever,
to come out.
headache, sore throat, yes, the rash is defining diagnosis. Okay, it's actually mainly a clinical diagnosis. If you don't have a rash, and the rash is peculiar, and there's so many diseases that can give rash. So you don't say that because I have rash now, it was monkeypox. A doctor needs to look at the rash and look at the characteristics of the rash and say that, this is monkeypox, this is chickenpox, or this is smallpox. So we do smallpox again. Or this is just measles rash. So there are distinct characteristics of the rashes in all these diseases that give rashes.
Okay.
If you don't have a rash, then it is not monkeypox. If you are still having sore throat, fever, body ache, tiredness, it can be anything. Okay. A lot of diseases can cause that.
Okay, the reason I asked that question, doctor, is because for measles, just as you mentioned, we've heard of cases wherein the rashes do not come out, it's inward and all of that in the case of measles. So I was just trying to find out if that's similar in the case of monkeypox.
And then the time span between the fever symptoms and the
outbreak of the
rashes. Okay.
Yeah, I didn't get the question. The reason you asked the question was because of what?
The reason I asked the question is because in the case of measles, we've heard, in time past that the rashes for measles sometimes do not come out on the surface of the body, that it's inwards, and before they even realize it's measles, it's probably too late. So I want to find out...
is there a time span or a time lapse between the fever outbreak and the outbreak of the, what's it called, rashes?
Yes, I mentioned it. I mentioned it that usually within 3 days of the fever, the rash comes out in monkeypox. And I don't know if you that the rash does not come out. If you don't see a rash, how do you diagnose a measles? It's as simple as that. A rash, that's why we say it's a measles. There are rashes, there are oral symptoms, the fever is there.
Okay. All right.
The redness of the oral mucosa, the occurrence of rash. So, a lot of diseases that have rashes, the rashes must be there before you say, this is what you are dealing with.
Okay.
That's the way it is. Okay. So for monkeypox, from fever to the rash is about 3 days.
Okay.
Okay.
So what I will say is...
So I'm wondering, within those 3 days, if you go to the hospital, what if you're diagnosed as something else? What if it is diagnosed as something else? Within the 3 days?
hopefully, as he said, that the rash will come out within 3 days or after 3 days, because, as I said, we've heard of cases where they tell you, oh, certain things didn't come out and all of that. But hey, this is a peculiar case, and I'm sure with monkeypox, just as the doctor is the expert here, it should, come out. I would like to hear his take on, the treatment. We know quite well right now that from researches and medical studies, there's no appropriate or blanket, cure for it. But what are the treatments?
Except the one for smallpox,
yes,
which he said has been effective also.
So I would really like, for him to explain that. And
there's okay, he's back, Dr. Tuyi.
Yes, I can hear you.
Yes, before we talk about treatment, Samson, I would like us to talk about at what point is an infected person no longer contagious?
Yes, it's a 21-day cycle. So once the person passes the 21 days, okay, fever, this and rash, and then once the person passes the 21 days, the person is then free from infecting other people. And in some countries, they do what they call the quarantine, self-quarantine. Okay. Go and stay at home for 21 days, where the thing will now be over. So that's 21 days window. Like I said, let's look at the flow of the symptomatology: fever, headache, body ache, lymph node enlargement. Then now the rash breaks, and then you look at the rash, it has certain characteristics, and then you say this is monkeypox. You will now do a test and confirm it's monkeypox. Anyone with rashes after having fever, headache, and body and lymph node enlargement should then have to see a doctor to confirm whether it is dealing with monkeypox or any other type of rash or another type of rash. That's the simple thing. It's not for you to just wake up and say, okay, no, I feel I have monkeypox, and then you are running helter-skelter. No, you have to actually allow that a doctor to talk to you on the diagnosis.
Okay. So what will be the treatment now? We understand there is no cure for it yet, but it can be treated. So what are the treatment like in terms of the measures?
Well, the first thing is that from the point of headache and body ache, of course, constitutional treatment, what we call the symptomatic treatment, is administered. Okay, yes, something to deal with the headache, something to deal with the fever and the intense body ache. Then if you confirm the rash, of course, some antibiotics to take care of the infection, secondary bacterial infection in the rashes. Then if you confirm the rash, if you confirm with PCR test, then you are then able to give some specific antiviral agents, okay? That one will happen in the hospital. But at the level of the home, it's just the basic thing you have to use, and self-quarantine. That is the thing. You shouldn't have the rashes and be running around, rushing buses, jumping from one place to another. No, you stay at home and self-quarantine. And then at the level of the hospital, if we suspect any of those things, the best thing is for the health workers to use personal protective equipment, so that they don't then pick the jab up. Because you surprise most of these diseases announce themselves in the hospital when they transfer it to doctors or nurses or health workers, and then it becomes the talk of the town. So we need to step up our personal protective equipment. We need to observe hygiene, hand wash. We need to avoid crowds. We need to actually, eat well so that our nutrition can be good. So, and then for a country, at the level of a country, then if it's possible, you may deploy immunization around the community.
So immunization can also work, because research shows that those who have been immunized against the smallpox disease can also be immunized against monkeypox. How true is that?
Let me put it in the proper context.
Okay.
Vaccine against smallpox also work for monkeypox. Okay. They are the same pox viridae, the same family.
So if you've been immunized against smallpox, you're also immunized against monkeypox.
Listen, have you been taking smallpox immunization as you are? No, smallpox immunization stopped since 1970. Okay? You understand? Since 1970, that's some years back. The new people are not being immunized against smallpox. Nobody is using smallpox as a routine immunization now. Okay? So what we are saying is that if you are thinking about immunization at all, if your country can get smallpox immunization for those people that are at high risk or for the environment that are high, they can deploy it. But we're not going to wake up and start deploying massive immunization like we did with COVID, because we're dealing with monkeypox. It doesn't have the same fatality. And the challenge of saying, well, are we going to close down the country is not going to happen because of smallpox. So, but of course, it's important for us to know that there's a new zoonotic disease in town that is appearing where it's supposed not to appear, and his name is called monkeypox.
Okay, doctor, is there a case we've seen that with COVID where those affected and are immunized or healed rather tend to pick it up again? Is there a possibility of one who has should I say survived or has gone past the monkeypox infection gets reinfected?
This is that once you pick it once, you are good for life.
For life.
You don't, yes, you don't have reason to pick it.
Okay.
All right, that's a fine place to leave it. Thank you so much for enlightening us on the disease called monkeypox. And of course, it is very important for us to be aware, especially as it is endemic in Africa. Thank you so much, Dr. Tui Mebawa, the public health expert, for your thoughts on IBrand Daybreak this morning.
Thank you for having me.
All right, have a good day. Okay, we'll take a break now. When we come back, we'll continue with the conversation right here on IBrand Daybreak. Please stay with us.